day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about GERD, gastroesophageal reflux disease. Most people just call it heartburn. This is an important topic for many people, as many of you are suffering from this ongoing condition. If you've had enough of the burning and belching and indigestion and you want a natural way out of that problem, stay tuned for the rest of this program. That's our concept for today, how to handle GERD naturally. But first, let's go to our news. Let's see what's happening in the health world. Nearly 1 in 3 drugs approved by the FDA has safety concerns that emerge after the medications are released for use. Researchers from Brigham and Women's Hospital evaluated FDA medication records for the years 2001 through 2010. Of the 222 new drugs approved, 61 received subsequent black box warnings, 59 received safety concern actions, and 3 were completely withdrawn from the market. The typical problem with a newly approved medication occurred 4 years after its first use. A study was published by the Journal of the American Medical Association. Well, folks, the fact that 1/3 of all approved medicines have side effect problems that emerge years after approval may be surprising to some. But with widespread use comes the realization of the true nature of our novel therapeutics, such as patent medication. There will always be untoward events when we use pharmaceuticals to treat our ills, as these agents are typically completely foreign to our bodies. In fact, 61 of the 222 drugs approved during this 10-year span showed unanticipated side effects when placed in general use. The report goes on to state the types of medications that were most likely to develop post-market events were the newly approved antipsychotics used for major mental illness, the selective serotonin reuptake inhibitors used for depression, and a relatively new class of drugs used for the treatment of autoimmune disease such as rheumatoid arthritis. These are called biologics. They also found drugs that were nearing their approval deadline when approved, or those that were granted accelerated approval processing, were more likely to develop post-market safety concerns. Folks, this is a lot to keep up with, even for doctors. We have the Food and Drug Administration for this exact reason, so that we, the patients, do not have to take on these scientific concerns without proper training. We've hired experts to handle this process, but even with their help, there will always be unexpected problems with medications. It just goes with the territory. Now, this does not mean we should stop searching for or approving new medications. That process must continue. What it means is that we should be careful with all medications, using them only when absolutely necessary, especially the new ones. I recommend following the sound advice offered to me during my medical training. Never be the first to use a new medicine. Wait for a few years of widespread use before you subject yourself or your patients to new medications. The advice also went on to proclaim, don't be the last to use new medications either, as the next new generation may provide true hope for those suffering with severe disease. Bottom line on this issue, exercise caution with new meds. Children with low vitamin B12 levels in early infancy struggle with mental tasks later in life. Researchers from Research in Norway evaluated 320 Nepalese infants at birth for their blood's vitamin B12 level. They re-evaluated the children at 5 years of age. They found the kids with suboptimal or low B12 levels at birth had trouble recognizing complex geometrical figures and recognizing other children's emotional state at 5 years of age. They also found most of the newborns from Nepal had suboptimal B12 levels. The study was published by the American Journal of Clinical Nutrition. Related research from the American Friends of Tel Aviv University finds babies that have thiamine or vitamin B1 deficiencies during the first year of life experience severely compromised motor function at age 6. The study followed 39 children that had been mistakenly fed faulty B1 absent formula during their first year of life. The study was published by Maternal and Child Nutrition. Also, from the British Psychological Society, researchers find when mother supplements folic acid throughout the entirety of pregnancy, it provides psychological benefits to baby. The researchers evaluated 39 children, half of whom had mothers who took folic acid for just the first 3 months of pregnancy, while the other half took folic acid for the entire 9 months. The study was conducted at Ulster University. Well, folks, this is an amazing line of research that adds further evidence to the notion that mothers that supplement their diet with vitamins during pregnancy have healthier and more intelligent and less disease-challenged babies. First, children born with suboptimal B12 levels struggle with difficult mental tasks at age 5. Next, we learn that babies tragically fed infant formula with no thiamine or B1 during their first year of life pay a huge price at age 6. Fortunately, the mistaken formula was identified, and all the children received replacement therapy and thiamine as soon as possible, and most recovered completely. However, not all. 3 infants died, and 20 were left with permanent disabilities, including epilepsy, all because their infant formula did not contain any vitamin B1. And we learned that when mothers take supplemental folic acid throughout pregnancy, it provides psychological benefits to baby years later. Previous research has shown when mother takes folic acid during the first trimester of pregnancy, baby's brain development improves. However, researchers wanted to know if there'd be any added benefits if mother continues folic acid supplementation throughout pregnancy, and yes, there are. The children demonstrate higher levels of psychological resilience, improved relationships with others, and they were better able to express their emotions. Bottom line, mothers, if you have plans to expand the family, please start eating a healthy diet and supplement that diet with a smartly compiled nutritional supplement plan. The difference in baby is simply astounding. Today on Your Health, we'll discuss the holistic approach to managing GERD or heartburn. Stay tuned to learn more.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Does acid reflux keep you hooked on antacids? If so, you may be suffering from GERD, which stands for gastroesophageal reflux disease. GERD affects at least 20% of the adult population. In fact, Americans spend hundreds of millions of dollars per year on medicines to treat GERD. This is unfortunate because these medications have side effects. They can cause additional digestive problems, and they lead to nutrient deficiencies, such as the depletion of vitamin B12. Fortunately, there are simple lifestyle changes that can reduce the symptoms of GERD. Avoid lying down or exercising within 2 hours of eating. Lose weight because obesity worsens symptoms. Limit foods that cause GERD, such as fried, fatty foods, mints, chocolate, and caffeine. To improve digestion, eat a diet rich in fiber, yogurt, and drink lots of water. For Your Health at a Glance, I'm Dr. Richard Becker. Different people have different vitamin and mineral needs. That's why Dr. Becker's BioNutrients multiple vitamin and mineral powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, BioNutrients has a multiple vitamin that's just right for you.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. We're back, everyone. It's such a blessing to be with you today, and I hope everything is wonderful in your life. Today's show is going to be quite interesting. We're going to talk about something that bothers most of us at some time in our life or another. That is GERD. We're going to talk about managing GERD the holistic and natural way. You know, this condition, this affects everyone, doesn't it? And if you look in most everyone's medicine cabinet, you're going to find one of the medications that we'll be talking about today. So, Richard, what is that number that America spends on GERD medications every year?
There's something like $100 million a year on GERD medications. $2 billion a year in lost productivity. $2 billion a week.
A week?
A week in lost productivity to American workers because of heartburn and GERD.
Wow.
GERD, gastroesophageal reflux disease, that's the condition. Heartburn is the major symptom of GERD. It affects between 60 and 80 million Americans will at some time in their life have heartburn, but 30 million or so are chronic or severe. And we'll refer to this condition as either GERD or heartburn. You know, reflux is another quick term we can use. We're all meaning the same thing when I say that. $2 billion a week in lost productivity, $100 billion a year on medicines, and many of these are over the counter. Are you taking Maalox, Mylanta, Tums, Gaviscon? Those are all antacid. Axid, Zantac, Pepcid, those are what called H2 blockers. They block the release of acid in the stomach. Pepcid, Prilosec, that's another H2 blocker. Prilosec, Prevacid, Nexium, Protonex, Acifex, these are what's called the proton pump inhibitors that profoundly suppress acid secretion in the stomach. There's others, Gelusil, Alka-Seltzer, Tiopan, Milk of Magnesia, Pepto-Bismol, baking soda, goes on and on. If you go to the pharmacy, and next time you go to the pharmacy, look for indigestion aids, digestive aids at the pharmacy. It's a whole row, dozens of different brands of agents, and you can very easily see. You don't dedicate that much retail space to something that doesn't move quickly, right? You have to do it that way. So this is a common problem. Many Americans have it, and we mostly rely on medications that do not really treat the underlying problem. 1 out of 5 have GERD at some time in their life. Around 1 in 10 Americans have it 5 or more days a week, and heartburn is the most common symptom of GERD. And GERD is a condition where acid vaporizes. It's not vomiting, although some people will vomit when they have severe heartburn. And it's not regurgitation, where some food comes up into the esophagus. It's the vapor of the acid from the stomach. It comes up into the esophagus, and we may inhale it into our lungs. It may touch our teeth and our mouth. That's the true reflux, gastroesophageal reflux disease. It's much like have you ever noticed if you pour a glass of wine and you let it sit and you look, you notice the alcohol from the wine refluxes and condenses up on the side container of the glass, and then it goes back into solution. It's a continual pattern of vapor condensing on the side wall of the glass. Have you ever seen that? I think everybody has. That's reflux. That's what's happening in your esophagus. The stomach acid is forming a cloud, and it's coming up, and of course it's highly acidic. It's hydrochloric acid. It burns. Whatever it touches, it burns. About 25% of pregnant women may have heartburn each and every day. It's very common as the intestinal, abdominal, and pelvic pressure increases from pregnancy. It tends to push food content up and the acid up. It's common in pregnancy. And children can have this as well. Up to 8% of children ages 3 to 17 may have heartburn and gastroesophageal reflux. Even newborns can have it. Honey, when I think of GERD in a human, it's kind of like colic in a horse. Colic is common in horses, isn't it? Heartburn is common in humans. What are the symptoms of GERD? A burning sensation in the chest and throat. Oh my goodness. And that's the heartburn component. Pain in the upper abdomen or chest spasms. Some people will confuse heartburn with heart pain. How many times have you heard, everyone's heard this story, well, he thought he was having indigestion, but actually he was having a heart attack. And he delayed seeing the doctor. Oh my, trouble. So it can be confused. It's not necessarily an acidic feeling. It can be quite confusing. You may have a feeling of hunger when you are not hungry. I just ate. In fact, I ate too much, but my stomach feels burning like acid, like I'm hungry. That's a common complaint. And what happens to a lot of folks is they go ahead and eat a little more, and it calms and counters that stomach acid, and this ends in weight gain, which makes the reflux even worse. There may be wheezing or hoarseness because the acid vapor, when pulled into the lungs, is highly irritating, and it can initiate asthma. Hoarseness because the acid vapor goes over the vocal cords and can cause irritation of the cords, even leading to polyps, and long-term, many years of acid vapor can even lead in some to cancer of the vocal cords. That's not very common, but it can happen. It can happen. Heartburn, GERD may leave a sour or acidic taste in the throat or the mouth, and over time it may even erode the enamel of your teeth. That is, acid can dissolve teeth. It can cause asthma flares, bronchitis, pneumonia, vocal cord polyps, hoarseness of voice, all of that we talked about. Chronic reflux can lead to Barrett's esophagus and esophageal cancer. Let me explain this, because this is a very important point and a good reason to get heartburn under control if you have this chronically. The esophagus is set up with pancake-like cells on the surface that can stretch, so when a food bolus goes through, these cells stretch and accommodate the volume, and it propels it on down. The esophagus is not set up to handle the acidity of the stomach. The cells in the stomach are more of columnar. They're little finger-like projections. That increases the surface area of the intestinal tract, the stomach in particular, and these cells they're created to handle acid. Well, if we have acid refluxing chronically into our esophagus, the pancake-like cells turn into the columnar-type cells. And if they continue to be irritated, these abnormal cells can turn into cancerous cells. We have so much more esophageal reflux in today's world and so much more GERD that our cancer rates, our types of cancer of the esophagus is changing. It used to be the most common type of cancer in the esophagus was of the squamous cells. Now it's changed. The most common cancer of the throat is now the adenocarcinoma of the finger-like cells. We don't want this to happen. This is called Barrett's esophagitis. If left untreated, it can go on to cancer, and trust me, you don't want that. Nobody wants that. Also, GERD can aggravate other conditions. If you have emphysema and you're breathing in this acidic substance, it's going to make the emphysema worse. It can make the asthma worse. It can make snoring and dental decay worse. It is a known cause of halitosis, and it may be a symptom of irritable bowel syndrome. About half of the people with IBS also have reflux. About half of the people with IBS have food allergies, food sensitivities, food intolerances. So if you're reacting to, let's say you're allergic to wheat, very common, your symptom may be heartburn. This is very common. We see this quite often. So keep that in mind. Reflux can be associated with other health conditions. Medications used for GERD are consistently among the top-selling drugs in the world and in the United States. Prilosec was the first drug that garnered $5 billion in annual sales. $5 billion. The sales for that class are far in excess of that now. We have more heartburn than ever. Digestive drugs account for about $1 billion a year in annual sales. Medicines, here's a key point, medicines lower acid levels, but they do not address the underlying causes of heartburn and gastroesophageal reflux disease. It is not a hyperacidic state. But if you lower the acid content of the stomach, the pH of the stomach raises a little bit, lower the acidity, you relieve symptoms. But heartburn is not due to too much acid. I'll explain in a while. Over time, low suppressed stomach acid from these medicines compromises digestion. This lowers nutrient intake and leaves us prone to intestinal infections, nutrient deficiencies, and a whole host of problems you don't need. And this problem perpetuates the use of medicines. Long-term PPI use, the proton pump inhibitors, that's the Prilosec class, we know that it can cause magnesium deficiency, B12 deficiency. It can cause bacteria to colonize the intestinal tract because the acid of the stomach kills most bacteria. It doesn't kill Lactobacillus acidophilus. This is lactose digesting, acid-loving bacteria. Probiotics survive the stomach acid, but That acid kills off other germs. But if we suppress the acid, the germs live, they thrive, and they create problems in the intestine, which further perpetuates. So we create a snowball effect that ends in daily medication use, misery, weight gain, and long-term constipation. Let's break the cycle. When we return, we'll teach you how to do it. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Do you suffer from cramps, gas, bloating, or other digestive troubles? How about fatigue, depression, and headaches? All these symptoms could be caused by a condition called lactose intolerance. Your body doesn't digest lactose, the sugar found in milk and other dairy products. As a result, you can suffer from a wide variety of symptoms. If you often experience digestive problems, fatigue, depression, or headaches following meals, try avoiding dairy for a week or two and see if your symptoms lessen or go away. All of the nutrients found in dairy, including calcium, are present in sufficient amounts in other foods. So if you find that you are lactose intolerant, you can safely avoid dairy and still enjoy complete nutrition. For Your Health at a Glance, I'm Dr. Richard Becker. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. We're back, everyone, talking about how we can manage GERD the natural and holistic way. Well, Richard, for us to understand GERD, we need to understand what causes it.
We have to counter these measures to truly make progress in managing GERD. One of the most prevalent and important reasons to counter is obesity. As we gain weight, this increases our abdominal pressure and it pushes food content up. And it can even create a hiatal hernia with so much pressure that the stomach wants to go through the diaphragm. But obesity is a huge factor. Some people will find if I just gain 10 to 15 pounds, I have terrible heartburn. Losing 10 to 15 pounds, I don't suffer from it at all. It may be that easy for you to truly manage your heartburn. Reducing diets, small meals, relieve the burden of digestion by over 100%. And this is often our only mistake, is that we're just eating too much and we eat too much late at night. Also, chronic constipation. With people who have heartburn and ongoing and chronic heartburn and GERD, they have constipation of the upper gastrointestinal tract. The stomach has delayed emptying. And this is primarily because the acid level in the stomach is so low that it can't digest where it's supposed to, and we're taking acid-suppressing drugs even further, and the food contents sit in the stomach far, far too long. So, first one, obesity. Even 10, 15-pound weight gain can cause your GERD. Chronic constipation, low-fiber diets, overeating, especially at night. And the third leading factor is intestinal dysbiosis. Altered bowel flora releases chemicals that paralyze the intestinal tract. Just paralyzed it. And so the food has nowhere to go, but that acid vapor comes up and it releases the sphincter tone between the esophagus and the stomach, these toxins, and you have heartburn. GERD is typically an intestinal dysbiosis, low stomach acid condition. As we age, our stomach acid levels decrease dramatically. 50% of us over 60 have low stomach acid, and 80% of us 80 and up have low stomach acid. And we're taking acid-suppressing drugs to handle heartburn. And they work. They work. They relieve the pain, discomforts of heartburn. But for long term, you're creating more trouble than it's worth for most people. This is called hypochlorhydria, low stomach acid, or achlorhydria. And you might be surprised how many people don't make any stomach acid at all, or very, very little. Low stomach acid delays digestion, upper intestinal tract constipation, compromises nutrient absorption, causes intestinal dysbiosis, and this results in indigestion and heartburn. Another condition, gastroparesis, which may occur in diabetics and people with nerve dysfunction or cirrhosis of the liver. This is an actual paralysis of the upper intestinal tract or anywhere in the intestinal tract due to nerve damage, most often associated with diabetes. This plays a role. Disorders of the liver and pancreas can cause terrible heartburn. We talked about weight gain. With weight gain often comes fatty infiltration of the liver. This, if left unattended, can turn to NASH, non-alcoholic steatohepatitis, which can, if left unattended and continued irritation from fat in the liver, can lead to frank cirrhosis. And people with cirrhosis have terrible heartburn. Terrible heartburn. So we don't want to even get close to that. We have decreased bile secretion, decreased pancreatic release of digestive enzymes. All of this delays the digestive process. Where does the acid have to go? But up, up, up. It's miserable. Linked to low antioxidant levels, all this acid vapor irritates tissues and it depletes our antioxidant systems. We need to replenish that for good healing. Vitamin C, vitamin E, and B12. It's also associated with hypercalcemia, associated with hyperparathyroidism. The majority do not have this. Don't worry about these things. But some, if you have hyperparathyroidism, your calcium levels may be high, and that can cause terrible heartburn. I just want you to be aware. And the reason we're telling you all these details is America treats their own heartburn. You can get these drugs over the counter, so you need to be aware of where you may be making mistakes, because you're being your own doctor. And that's okay with me, as long as you're smart about it. You got to be smart about this, because we can get in a lot of trouble with these medicines if we don't know what we're doing. So, obstructive sleep apnea can make heartburn worse, gallstones, liver disorders, cirrhosis, and even some of the autoimmune diseases. People often say, well, I have a hiatal hernia, so I can't control my heartburn. Not so. Keep the weight down. 50% of the people over 50 years of age have a hiatal hernia, but only 5% get reflux, according to one study. But if you have a hiatal hernia and heartburn, that's hard to manage. You're going to have to do most of the things on the list that we're going to get to in just a minute. The foods you eat may be reacting. Foods like soda, hot, spicy foods. Many people, I'm fine until I eat the tacos. Then I'm miserable. I'm just miserable. Is that like how you are? Well, you know, if we can control this heartburn, you might find you really enjoy tacos, because they're basically good food if prepared properly. Chocolate loosens the sphincter between the stomach and the esophagus, but many people can't have it because it gives them heartburn. Peppermint and other minty foods, spicy foods, citrus, tomato, high acid containing foods, all of these may, and this is highly individualistic. Tobacco may irritate gastroesophageal reflux, and alcohol, without a doubt. All of these factors and some medicines. Let's name a few medicines. Wouldn't it be something if the medicines you take for one problem is causing your heartburn and you have to take 2 or 3 medicines to control the heartburn, and all the while, the left hand doesn't know what the right is doing. That'd be pretty rough. What about antihistamines known to cause GERD, calcium channel blockers for hypertension and other things, muscle relaxants, aspirin, ibuprofen, all the non-steroidals, narcotics can cause terrible heartburn, and acids can cause rebound secretion of acid, as do the proton pump inhibitors. The medicines themselves can cause it with terrible rebound. Bisphosphonates for osteoporosis. If you're on a long list of medicines, have the pharmacist check it for heartburn. It may be necessary to make progress. We have the holistic tips when we return. For centuries, the herb Astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with Astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what Astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Our health depends on the choices we make every day, and few conditions are as dependent on our choices as diabetes. So here is your daily diabetic checklist. Number 1, take your diet seriously every day. Eat lean protein and leafy vegetables. Number 2, sugars and starches raise blood glucose, so reduce them in your diet. Number 3, check your blood glucose and record the readings every day. Number 4, take your medication daily and don't skip. And number 5, try to exercise every day. It will help you take off weight, which will help your body regulate blood sugar better. If you are diabetic, this is your quick daily checklist that could make life better. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and Cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. We're back, everyone, learning how we can manage GERD the natural way. So, Richard, if we're really suffering, we need to probably go to the doctor. This is something you can't totally do on your own.
Sometimes,
so when you go to the doctor, they're going to give you some tests. So let's talk about what you could expect.
Well, you may have a barium x-ray where you swallow the barium, they take an x-ray of your upper intestinal tract, and then they wait a few minutes to see if the barium all clears out of the esophagus and goes down in the right direction like it's supposed to. And when they take that second picture, if there's still barium up in the esophagus, there's a reason for that. And that's an indication that there is heartburn and gastroesophageal reflux. They may also put in a pH monitor into your esophagus. They may put a pressure monitor in the esophagus. They don't do that very often, but sometimes they have to come to understand why you're suffering. Probably the most common test is the EGD, esophagogastroduodenoscopy. That's the microscope down the throat, and they look at the tissues, and they can tell, and they look for the change in tissues from the chronic acid irritation. And one of the advantages of that study is if they see an abnormality, they can take a little biopsy of it, and then we know if we're on the door to cancer. We don't want that. So that's the advantage of the EGD. But I want you to know, by far and away, the most common way to diagnose gastroesophageal reflux disease is to just ask questions and tell the story. And even doctors do this. If your treatments do not work, it's important to follow up with it, because you may actually have an ulcer in your stomach. It feels very similar. You may have a cancer in your stomach or upper intestinal tract, and the treatments for GERD will help relieve the pain of serious illness. I have met people who actually had a stomach cancer. They started a PPI like Prilosec, and they felt better, so they didn't think they had cancer. It wouldn't help cancer. Well, it does. It helps relieve the pain of the cancer. So, you know, we want to make true and distinct progress. If not, check with your doctor. Make sure you don't have gallbladder disease, cirrhosis, a cancer, an ulcer, this type of thing. And some of them can be serious, but far and far away, the vast majority, it's just heartburn. It's just heartburn. But you can get all these medicines over the counter. That's why we need to have increased awareness. All right. How can we quench the fire of GERD? For best results, all the factors that we've discussed today should be addressed to get the best control. Special attention to regularity and yeast control, because the yeast and the dysbiosis create toxic chemicals that furthers GERD. Weight loss, number one, if you put on some weight, lose weight. Lose weight. And understand, when you stop the medicines, you can get a rebound, particularly the PPIs, the proton pump inhibitors. You can get a rebound acidity. They're dependency forming for about half the people. Weight loss, number one. Number two, drink at least 100 ounces of water. If you're in heart failure, you'd want to have less. You need to follow the advice of your doctor. If you're in kidney failure, you'd want less. But most of us don't drink enough water. One of the primary symptoms of chronic dehydration is reflux disease. You get a lot of heartburn when you're chronically dehydrated. When you're drinking enough water, you don't get nearly so much. Exercise, 30 to 60 minutes of walking, standing on your feet, moving about. You can do more. You can do aerobics, you can jog, ride a bike, do whatever you want, but get up and move 30 to 60 minutes a day. This does as much for heartburn as anything. It promotes regularity. I once knew a man who sat in a bulldozer all day long, and he was a hard worker and a good man, and he contributed to the community. But he had the worst heartburn in the world because he never moved much. It doesn't take a lot of effort to drive a bulldozer. And if nature called, he did not answer, because it's hard to stop the bulldozer and get off of it and go find an outhouse. You know how construction work is. I'm being frank with you folks, so you know how to handle this. So he was chronically constipated. He had terrible heartburn. When we addressed those issues, he said, boy, I feel great, doc, thanks a lot. It wasn't that hard. Just get him regular potty breaks, plenty of water, and his problem was solved. What else? Eat a good breakfast, a medium lunch, and a modest dinner. Less food late in the day is going to help your heartburn, and no food after 8 o'clock. Think of it this way. When we go to bed, folks, we can either detox and purify our systems from the day's events, or you can try to metabolize and end up with heartburn. The later you eat, the more heartburn you're going to have. Eat more in the morning, less in the evening. Make your meals smaller, and you're going to go a long ways to managing heartburn. Avoid acidic foods such as citrus fruits and juices, and this is unique to the person. Some people can have citrus and others can't. Find those foods. You may need an elimination diet. Control your IBS and food allergy sensitivities and intolerances. Eat a high fiber diet with fruits and vegetables. Fiber is essential for managing GERD. Reduce your fried foods. Fried foods open up the sphincter and allow that vapor to come up. You'll see it. Oh, I love the chicken fried steak, and who doesn't? But oh, whenever I have it, oh, I'm miserable all night. Everyone's heard of these stories. This is very typical, so be careful with the fried foods. Reduce your starch intake. And please cut the high fructose corn syrup down because it tends to deposit fat in the liver. When we have a fatty liver, you're going to have terrible heartburn. And it tends to promote weight gain. Juice with carrots, celery, and cabbage. Those three are particularly effective for heartburn. Take 1 to 3 teaspoons of apple cider vinegar. You can put that in water, drink it before a meal, because remember, GERD is a low acid state. A little vinegar, acetic acid, apple cider vinegar, complements the meal. See, most people don't understand how acid works in the stomach. When we have acid in the presence of water, the stomach environment, and we put a protein in it, that hydrolyzes the protein and releases it. It does not use up the acid, it uses up the water. Do you understand that? It doesn't use up the acid. So acid in the presence of water hydrolyzes protein, digests it. Okay? So a little extra acid can do wonders for heartburn. Isn't that something? But you wouldn't want to put a little extra acid on a stomach ulcer. So if that hurts you, you may need to see the doctor for further testing. Well, let's go to our break, but we're not done yet. We have a few other things that will make a big difference, and then we have vitamins, supplements, and other nutrients that would help you with your GERD. We'll be right back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
Here is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At Bioinnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone. We've been talking today about how you can manage GERD the natural and holistic way. We've been going through the lifestyle tips that can really help you start taking control of this disease. So, Richard, the apple cider vinegar was quite an interesting concept.
It is.
Really interesting concept.
One of the traditional meals, the first course of a meal is a salad with oil and vinegar on the salad. So you can incorporate this into your diet. A little apple cider vinegar with the olive oil on the salad. That's a digestive aid. It gets the stomach environment right to release the protein, which releases B12 and other nutrients, so you can have proper digestion. Quick, efficient digestion in the stomach is the essence of improving GERD. It really is. And a little extra acid in the stomach goes a long way to doing that. And I would use apple cider vinegar. Why? Because it contains a probiotic in it, which is something you get added benefits. Lying on your, let's do this, keep your head elevated when you sleep. Do not lie down for 2 hours at least after your last meal. That makes a difference. Now, this does not mean simply propping your head up with 5 pillows. What that does is it tends to bend you and put more pressure on your stomach. This is raising the entire head of the bed up with a block or two under the head feet of the bed. You know what I'm trying to say? So you're not bending at the waist. That's the most effective way to do it. Many people will just put the pillows there and it puts them into a bind, and it's not as effective. Now, it takes a little while to get used to sleeping at an angle, but it can be very effective for chronic GERD, especially when the esophageal sphincter is relaxed. That helps that quite a bit. Lying on your left side can relieve heartburn, and it does this by keeping the stomach below, the majority of the stomach below the gastroesophageal sphincter. Some people find that quite helpful. This is very helpful during pregnancy. Do you remember those days, Cindy? Almost every woman has a little heartburn. Did you have heartburn?
Not too much.
Not too bad?
Not too much.
Well, ladies, during pregnancy, if you find, oh my goodness, a little Mylanta or something, just a little, not too much, lay on your left side, and usually that helps quite a bit. You can use medications, the acid-suppressing drugs, antacids. You can use them to bring your symptoms under control. I don't want anybody to suffer needlessly, but remember, long-term use of these medicines, we're not addressing the core underlying reason, and it can perpetuate the problem and even make it worse in some instances, and open the door to nutrient deficiencies and things you just don't need. So get some relief. I'm all opposed. Or the occasional use. I only get this when I travel or this, that, you know, maybe once or twice every 3 months I'll get some heartburn. I don't have a problem with people using medicines for that. I don't have a problem with that. But every day, and there are millions of Americans doing, every day it's a proton pump inhibitor, the purple pill every single day. And if they miss a day, oh, they're just miserable. Do you know somebody like that? We can help those people with these measures. And remember, as we're addressing these problems, if you've been using medicines for long term, you probably have suboptimal low magnesium levels, suboptimal B12 and other. So we need to replace those. So our first step to restoring good digestive health in light of GERD is to replace these nutrients. A high quality, multiple vitamin and mineral representing all the known essential nutrients. Digestion is a complex process, and all nutrients are required to properly digest more nutrients. That's just how it works. For example, the enzyme that pulls calcium into the bloodstream from the gut has 2 magnesium molecules associated with it. That enzyme doesn't work well unless magnesium is present. So we have to have one thing to absorb the next. That's how the system works. So we've got to replace these nutrients. B12, sometimes the sublingual tabs, some people have to take shots to get better on their GERD. B-complex, improve your antioxidant status, your vitamin C, vitamin D, vitamin E, vitamin A, and don't forget that magnesium. Fiber, this is essential. Promotes regularity, absorbs those toxins we talked about, promotes stomach emptying, which is a good thing. We want to do that. Both soluble and insoluble fiber play a role in improving GERD. So our favorites, glucomannan, a source of soluble fiber, and psyllium, a source of insoluble and soluble fiber, either one, whichever you tolerate best. About 20–30% of people who take psyllium go, oh, that's not good for me. They'd rather do the glucomannan. Either way, but get more fiber in your diet. Probiotics, healthy intestinal bacteria, restores healthy intestinal bacteria. A new study showed probiotics promote intestinal mobility. It's a pro-motility agent, probiotics. Isn't that wonderful? Noni juice, one of the best pro-motility agents you could ever imagine. There are medicines that do this, but they are fraught with side effects, especially as we get older. Be careful with the pro-motility agents that are not natural, like noni juice. Noni juice has none of those side effects. So an ounce or two, up to 4 ounces prior to meal, and then have your meal. Do that 2, maybe 3 times a day until you're feeling better, then less is required. Digestive enzymes can be very helpful. You know, the enzymes that your pancreas would make. There are products like betaine hydrochloride and bile salts. All of things can help with the digestive process, but if you have a stomach ulcer, betaine hydrochloride is going to hurt you terribly. So be careful with those. If you're tolerant of them and you have nothing but heartburn, nothing but GERD, those agents, the digestive enzymes and the betaine hydrochloride, which is stomach acid, can be very helpful. Can be very helpful. Next, improve your liver function. Milk thistle, alpha-lipoic acid, and these other measures like probiotics help improve liver function, especially if you have fatty infiltration, weight gain, fatty filtration of the liver. You're going to have trouble managing your GERD until the weight comes down and the liver is fat-free. Boy, what a difference it makes. Milk thistle and alpha-lipoic acid can help that. Curcumin, turmeric, and all the antioxidants like resveratrol restore the antioxidant balance in the intestinal system because it's been under extreme stress with heartburn, and we have to compensate for that. Mastic gum, things like oil of oregano, things to control the yeast can work wonders also. And oil of oregano, grapefruit seed extract, apple cider vinegar, but oil of oregano. Now, I've said a lot of things here, a lot of things. And not everyone needs all of this. So I'm going to give you the 4 most important things of your dietary supplements. Noni juice, oil of oregano, glucomannan fiber, and probiotics. All the lifestyle measures apply, but noni, oil of oregano, glucomannan, probiotics. You start that program, the vast majority, 95% of those with simple GERD will be happy and living a good digestive life within a week. And I mean that. It's really quite remarkable. You got to do your part. You drink, you eat less, all those things we talked about, and heartburn can be a thing of the past. Well, folks, we will be right back for our wrap-up. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings. I'm Cindy Becker for Your Health at a Glance. Are you looking for a healthy replacement for sodas? For thousands of years, the Far East has enjoyed the many health benefits of green tea. Now the Western world has embraced this potent antioxidant for its many health benefits as both a drink and supplement. Green tea has been thoroughly researched. It's been shown to improve bone density and immunity, as well as levels of cholesterol, blood sugar, and blood pressure. Research has also shown it to decrease inflammation and one's risk of cardiovascular disease and many forms of cancer. One recent study even found that people who drink 5 or more cups a day were 33% less likely to develop conditions that cause disability. For health, it is everyone's cup of tea. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best: noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Richard, I know time is short, but let's recap those top 4 supplements that can really help with GERD.
Noni, to help promote regularity and motility in the upper intestinal tract. Oil of oregano, to help control yeast and abnormal bowel flora. Dysbiosis is common with GERD. Glucomannan fiber, to keep things going and to promote the absorption of toxins. That's something I want everyone to understand. When the bowel flora is off, you make poisons. And it plays a major role in paralyzing the upper intestinal tract. So we've got to restore bowel flora, and glucomannan, fibrous agent, soluble fiber is very helpful there. Then, of course, probiotics to colonize the intestinal tract. Now, if you can't get all this down, our book, Foundations for Healing, has an entire chapter dedicated to heartburn and peptic ulcer disease, what to do in those settings. Also, you can get a copy of this program. If you have a friend or a loved one who suffers from chronic heartburn, you would be doing them a great favor to get a copy of this show and give it to them so they can sit and play it, take notes, and figure out how to help themselves. Because I want to ask you, and if I'm wrong about this, tell me, how many of our standard of care medical doctors and osteopathic doctors actually tell you these holistic measures when you go to visit? Nope. Out comes a prescription pad, Prilosec, Nexium, whatever the hot drug is, or just go get some Tagamet. Or nobody takes Tagamet anymore, but that's usually what you get, isn't it? Well, there's so much more to this. If you really want relief, we got to go the holistic way. Heartburn, GERD is a common problem that may worsen with age. GERD in the vast majority of cases is not due to excess stomach acid. It's more likely to be associated with low stomach acid levels. Suppressing acid over time can cause more problems than it's worth. Get the relief you need, I understand that, but develop a program to restore the ecosystem of the gut. That's the key. Heartburn may be making other health conditions worse, be aware of that, and heartburn can be confused with other serious health conditions. So don't assume it's just heartburn. If you're not responding, talk to your doctor for a physical. A complete holistic program with changes of lifestyle, a few key dietary supplements can make all the difference in your GERD. Thank you for your kind attention. We'll see you tomorrow, folks. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
Oh, listen now. Can you hear the bluebirds? Oh, look up now. Can you feel the sun?